On behalf of the Centers of Medicare and Medicaid Services, the Administration for Community Living, and the Indian Health Service, I would like to welcome everyone to the Long-Term Services and Supports webinar series. My name is Julie Cahoon, and I work for Kaufman and Associates. I will be the moderator for today's webinar. Before we begin, I would like to highlight the main features of your webinar interface. First is the main window where you can see the PowerPoint slides. To the bottom right of the window is the Q&A pod. You can enter a question for our presenters at any time in the Q&A pod. However, today's question and answer period will be at the end of the presentation. Just above the Q&A pod is a Files pod where you can download a copy of today's presentation slide set. To download, click on the file name to highlight it, and then click on the Download File button. Also, please note that all hyperlinks shared throughout the presentation are active and clickable. If you click on a link, it may pull up a new browser window. To return to the webinar, minimize the browser window. If you need technical assistance during the webinar, please enter your tech support question in the Q&A pod. Our tech support staff will be monitoring these questions throughout the webinar and will work to answer your tech support questions right away. You will receive an answer in the Q&A pod. Finally, please be aware that today's webinar is being recorded and that the recording will be made available online in the near future on cms.gov. With those announcements made, I'd like to welcome everyone to today's webinar. Our presenters today are Marnie Land and Dr. Susie Postal. Marnie Land is a Senior Technical Advisor in the Division of Program Management at the Centers for Medicare and Medicaid Services. She has served in this capacity for 15 years. Ms. Land provides integration project management support for many of CMS's key initiatives, including this current initiative, the new Medicare Card Project. In her role as a federal partner liaison for this project, Ms. Land works directly with the federal agencies operationally impacted by the new Medicare Card numbers, including SSA, RRB, and Indian Health Service. Dr. Susie Postal currently serves as the Chief Health Informatics Officer for the Indian Health Service after 28 years at the National Institutes of Health. Her professional nursing career focused on three main areas: psychiatric, intensive care, and informatics. Dr. Postal's focus is bridging information technology with healthcare to promote quality patient care and improve patient outcomes. At the Indian Health Service, she supports and leads various quality initiatives. Dr. Postal provides national and local leadership in transitioning to the Quality Payment Program and the new Medicare Card. Thank you both for taking the time to join us today. I will now turn it over to Ms. Land for an introduction to today's topic.
Thank you so much, Julie. Good afternoon, everyone, or good morning for those of you on the West Coast. As Julie mentioned, my name is Marnie Land, and I am the Federal Partner Liaison for the new Medicare Card Project. And I've been asked to present information about the new Medicare Card Project in your monthly seminar series. Can we go to the next slide, please? All right, so in today's world, the insurance number Medicare beneficiaries use is referred to as the health insurance claim number, and it's based on a Social Security number, either a person's own Social Security number or a family type number. 2.5 years ago, almost 3 years ago, Congress passed a law that requires us, CMS, to change that insurance number. It cannot be part of a Social Security number, a fraction thereof, and we have to give each person in Medicare a new number and a new card within 4 years. So by April 16th, 2019. Next slide, please. All right, so hopefully you've seen the new card that we launched in September. What exactly is this new Medicare number that we are giving to our beneficiaries? It is 11 characters in length, same length as the current health insurance claim number today. So it can occupy the same field as any insurance number. It is both alpha and numeric, and as you can see, it is more of an equal distribution of numbers and letters. It is unique. These numbers are completely random, and no embedded logic or intelligence. So if there are a husband and wife that, quote, share a retirement account, one card is the Social Security number with the letter A at the end, and the other card is that same Social Security number, but with a B or other letter at the end. Those two numbers exist in the Social Security Administration world, but they each will get their own Medicare beneficiary identifier or Medicare number. We are omitting a few letters that can be construed as numbers, and we are not using any special characters and no inappropriate combination of letters and numbers. And I also wanted to point out that the Railroad Board does have their own card, and we were able to provide a screenshot of what their new card looks like. The difference is the Railroad Board has an RB logo, as well as it says Railroad Retirement Board in the red stripe. Next slide, please. So let's talk a little bit more about these identifiers. What identifiers are changing and what identifiers per se. The Social Security number will not change. If you do business with a Social Security number, if you collect it, transmit it, and it's just the 9 digits, nothing will change. The Social Security Administration's claimant account number, which is what I was talking about before, an SSN with a specific letter, referred to as a beneficiary identification code, that will not change either. Social Security Administration will still manage retirement benefits, disability benefits with that claimant account number. Now today, Medicare adopts that number as the insurance number, the HICN. ORB also adopts that number in a way as their HICN. Those are the two numbers that are changing. CMS is giving every Medicare beneficiary, including those who get their benefits from ORB, a new Medicare number, which we refer to with our provider community as a Medicare Beneficiary Identifier, or MBI. Next slide, please. All right, so as a provider in this timeline, you should be preparing, testing, and hopefully almost implementing, if you've not already done so, systems and business process changes to use the new MBI starting April of 2018. If you use vendors for your healthcare management system, please contact them to find out how you're being impacted. We are planning to begin mailing the cards in April of this year. Next slide, please. So when we start mailing the new card, you will start seeing the new number, and hopefully people can use it right away, but we are not flipping a switch and jumping right on over to the new number. It takes a while to mail out almost 60 million cards, and we're giving the market time to adopt the new number, 21 months, all the way through December 2019. So let's talk a little bit more about this transition period. Next slide, please. So the time frame, April 2018 all the way through December 2019, which means we all, you all, need to be ready to use this new number. Now, during the transition period, you may use either the HICN or the MBI in your transaction. So if a person shows up with their current card and number, no problem, you use that number. Person shows up with their MBI, you are ready, you put that number where you would normally put the HICN on your claims or your eligibility lookup, and it would be accepted, assuming the person has Medicare. If you submit a health insurance claim number, we are going to return the health insurance claim number. If you submit an MBI, we will return the MBI. You can do this all throughout the 21 months. We are going to monitor healthcare providers in their adoption of these numbers in anticipation that we will be able to cut over to using only the MBI starting January 1st, 2020. Next slide, please. A couple of things that you will notice in operations during the transition period. If you query our HIPAA eligibility transaction system, or HETS, with a person's HICN, and we have already mailed their card, we will send you a reply message letting you know and let your patient know that we have mailed their card. Starting in October of 2018, if you submit a HICN on the claim, we will process the claim with the HICN, but we will also give you back that patient's NBI to help you populate your patient's records. Again, let me reiterate, you may use either the HICN or the NBI in a Medicare transaction. If you are batching individual transactions together, that is fine. The batch can have a mix. Next slide, please. We are providing the new NBI to state Medicare agencies and supplemental insurers to assist them in processing their claims so that whether a claim is submitted with a HICN or an NBI, these crossover claims can be processed. The Railroad Retirement Board beneficiaries. The key thing to remember here is that their Medicare number is no longer visibly distinguishable. They get an NBI just like CMS beneficiary gets an NBI, as our NBIs have no embedded intelligence. So, if you are only looking at the data record, you need to have some sort of indicator or note that the beneficiary is an RB beneficiary so you can send that claim to the special MAC, the Medicare Administrative Contractor for the Railroad Board. RB cards will be mailed by RB, and as you saw previously, have the RB logo and name on it. Next slide, please. Private payers won't have to use this new number initially, but once the transition period is over, like many other folks, they won't be able to use the HICN either. They will have to use the new NBI. Now, we know in today's world that the current Medicare number is a lot easier to use. It's a lot easier to remember, and patients don't always remember to bring their card with them. So we have been working to develop a tool where if a patient presents without their number and you need to provide care, they're not already in your system, as a provider, you will be able to look up their new number securely. It has been known as the provider lookup tool, and it will be accessible via your Medicare Administrative Contractors, the MAC, portal. If you do not currently use the MAC portal, please sign up. There are instructions and links at our cms.gov/new card website under the Provider tab. Next slide, please. Now, while many healthcare operations will be required to use the new Medicare number, there are situations in which, even after the transition period is over, you will still be allowed to use the HICN for appeals, adjustments, reports. Continue to the next slide, please. A few more situations where either number can be used. We will always accept payments with either number's premium payments from a beneficiary. And if a person begins medical treatment during the transition period and presents their HICN, and they don't end their medical treatment until 2020, these are known as span date claims, then yes, you can submit a claim with that HICN. And reporting, both incoming and outgoing, can have both Medicare numbers after 2019. December 31st, 2019. Apologies. Next slide, please. CMS is really committed to making sure that the provider community gets the new NBI for their patients. As I stated previously, starting October 1st and throughout the remainder of the transition period, if you submit a claim with the HICN, we will return the NBI on the remittance advice. And there are several remittance advice ways that it is delivered to providers. We provide examples in the links in our webinar today, as well as our CMS.gov new card website. Whether you get a Medicare Remit Easy Print or a PC print, next slide please, or a standard paper remit, all of those remittance advice will have an MBI starting October. There is a note. Don't forget, if you submit claims electronically, you'll get an electronic remittance advice. You can also see and print the ERA through MREP and PC print. Next slide, please. So we also want to talk about the E1 transaction. The E1 transaction operates both like an eligibility transaction and a remittance. It's processed at point of service. So you can use either number for eligibility, whichever one the patient presents. And just like we are returning the MBI on remittance, if you submit a HICN, we will do the same on the E1, return the MBI. All of this is done on a one-to-one basis. Now, some of the larger pharmacies have requested an E1 batch processing to update their files, and if you fall into that category, you can contact our Part D Coordination of Benefits contractor. Next slide, please. Our Medicare Learning Network is always pushing out new information, especially when we post updates on our CMS.gov new card website. We have two main messages about this new card and new number. One is to make sure that your patient's addresses are up to date, and they must go to SSA.gov to do it. Second, please advise your patients to beware of fraudsters. For the most part, CMS will never contact them by phone and request personal information. The card is free, and you don't need to do anything. Just sit back and wait for it to be mailed. Next slide, please. As a provider, you need to be able to accept this new number starting April 1st. Make sure you are talking with your information technology folks or the company you use to manage your EHR system. The provider lookup tool will be available via your MAC portal in June of 2018. Next slide, please. Alrighty then, we are on to the mailing. We will start mailing this April. Newly eligible beneficiaries will get a card with a new MBI. Existing beneficiaries will get a card with a new MBI. And we have a distribution via a phased geographical approach. Next slide, please. So many folks have been interested in that phased geographical approach. This information is found at the CMS.gov new card website. The way we are working this approach is we group a bunch of states together and call them a wave. We will mail cards belonging to that wave over a period of time. When a wave finishes, we start the next wave. So we are targeting to complete the first two waves during the initial 3 months of our mailing. Next slide, please. Providers and partners and assisters have also been asking about what the mailing looks like so that they can help beneficiaries recognize the envelope and the card when it comes in the mail. Next slide, please. All right, here is our envelope. I believe we just added or will be adding the official information from Medicare piece on the back. Hopefully that will encourage them to open the mail. Next slide. Here is our card. The card is perforated. Many of you have seen the front of the card. There is text on the back of the card, which is not displayed here, but it is very much like the text on the back of the card today. Things like, you may be asked to show this card to get health services, Only give this information to providers, insurers, people you trust, as well as fraud warnings and the ways to contact Medicare. Next slide, please. With each card, there will be a letter included explaining why we are sending these cards, both in English and Spanish. Next slide. As well as help in other languages. I believe this is the Spanish version. Next slide, please. We're also mailing the letter in alternative formats based on a preference the Medicare identified in our database. As long as the beneficiary's communication preference has been changed in our database, the beneficiary will get an alternate format package, such as Braille, CD, audio CD, or large print. If a person desires to get this information, the letter, not the card, but the letter in alternative format, please have them call 1-800-Medicare. Next slide, please. So people should make sure that their current address is correct with SSA. People who lose their card will be able to continue to get a replacement or duplicate card. And if you believe you are a victim, your patients believe they are a victim of identity theft or Medicare fraud, you will be able to get a new Medicare number. You must call 1-800-Medicare to do so. Next slide, please. We also have outreach education materials that you can order free of charge. These materials are a part of the CMS product catalog. Next slide. We started to enhance our outreach education at the end of January, still focusing on the fact that we will be mailing new cards, the address is up to date, and beware of fraud. In a few weeks, we will start additional outreach for efforts in Wave 1. Next slide, please. When the mailing begins, we will launch a page in Medicare.gov. The Medicare.gov site is beneficiary focused. In the Medicare.gov site, there will be a prominent page featuring the new card mailing. A person can visit this page and provide us their email and state, and CMS will email them when we start mailing the card in that state. We are also enhancing capabilities within the MyMedicare.gov tool. This is the personalized account where a beneficiary must authenticate themselves, and they can access their Medicare summary notices online and request a replacement card. Some of the enhancements that we are doing to our MyMedicare.gov tool includes printing the new Medicare card. Once we mail the card, if the person has already established their MyMedicare.gov account, they will be able to go into that account and see that functionality and produce their card right from their computer. Next slide, please. We are using a lot of outlets to inform our partners and the public. So this is a great chart showcasing the type of products we are producing and when we're using them in certain venues. Next slide, please. I'm now going to turn this next portion of the webinar to my new Medicare card counterpart at the Indian Health Services, Susie Postal.
Thank you, Marnie Ann. Thank you, everybody. I'd like to share what spotlights are being done with the Indian Health Service. Next slide, please. So first, to start off and reiterate what Ms. Land had noted, we are continuing with outreach and education within the Indian Health Service in collaboration with CMS. For those sites that have a vendor for their electronic health record, we highly encourage you to reach out to your vendor to make sure that you are ready by April 1st to accept the new Medicare beneficiary Identifier, or MBI, the new Medicare card number. For those sites who use our Resource and Patient Access System, RPMS, Resource and Patient Management System, RPMS, we will be ready. We are looking that we have about 7 applications within the RPMS electronic health record that are being updated to accept the new number. It's a total of 8 applications, including our national data warehouse. So we are making sure that all these applications will be ready to accept the new number. Here is a listing of the different applications within RPMS, Resource and Patient Management System, that will be impacted. Next slide, please. Some of the high-level schedule that I'd like to share is with the impacted applications, we're looking at doing alpha and beta testing with a national release date to be ready by the 28th of March. Training sessions, hot off the press, I just received, but we will be having training sessions for those sites that manage the applications. We're looking at March 27th for the impacted applications with 1-hour training sessions, which will be recorded, as well as 3 other sessions in April. April 6th, April 13th, and if necessary, April 27th. Next slide, please. Marnie, I'm not sure if you want to talk about this a little bit with the key points to remember with the pharmacies and providers.
Thank you, Dr. Postal. All right, this comes to the end of our session. The reminders. Everyone needs to be ready by April 1st, 2018, with both their systems and their business processes. Yes, we are going to start mailing cards. Okay, April 1st is a Sunday, so April 2nd, USPS will be mailing those cards. There will be a 21-month transition period starting April 1st, 2018 through December 31st, 2019. Providers, including the pharmacies, will have 3 ways to get the new MBI. The patient presents the card, the provider will receive it on the remittance advice in October, or provider can obtain it through a secure web portal with the MAC. That's starting June of 2018. There are a lot of resources available for you to use when you're talking with your patients or anyone with Medicare and caretakers. These resources are available at the cms.gov website. Next slide, please. And here is the URL for that cms.gov website. This is for the provider community and our partner community. We like to direct our beneficiaries or people with Medicare to the Medicare.gov website versus the CMS.gov website. If you have any questions after today's session that you weren't able to submit, questions are always welcome. We have a special email box set up at New Medicare Card, SSN Removal at cms.hhs.gov. Starting April, this URL will be live, and that will have the information about the mailing and the ability to sign up to get notified via email when mailing starts in a particular state. Back to you, Julie. So
Great, thank you. So
thank you.
This is our time for questions. Please enter your questions in the Q&A pod located at the bottom right side of your screen. This will be the time for Mari and Dr. Postal to respond to any of your questions about the new Medicare cards.
Thank you. So our first question is, and thanks to the person who asked this, will patients who are enrolled in Medicare Advantage plans also be receiving new Medicare cards? The answer is yes. Every person who is a Medicare beneficiary, regardless if they're enrolled in Medicare Fee-for-Service or Medicare Advantage, will get a new Medicare card. And this is because while they still will use their Medicare Advantage card to access health services, should they want to change Medicare Advantage plans, they will need their Medicare number to do that. I also believe that at times when people go into inpatient facilities in certain situations, it reverts from the Medicare Advantage number back to the traditional Medicare number. So it's important that every beneficiary will have a new card. They might not use it right away for services, but it's important for them to have a card. The next question. Persons receiving spousal benefits while they wait to turn 70 and are using their own earned benefits. How will this affect me when I move from spousal to my own benefits? Thank you. This perfect example. So currently, this person has a spouse's Social Security number on their Medicare card. You will get your own Medicare beneficiary identifier card, so Medicare number. When you switch over, when SSA switches you over to your own Social Security number, your Medicare number will not change. So you will not get a new card. However, if we have not mailed your card when you make the switch, if you're making the switch in the next 6 months, and we have not mailed you your card, then you will get, when you switch over, you will get one. I probably just confused the situation more, but if someone's Medicare number changes prior to us mailing them their new Medicare card, then we will need to mail them a new Medicare card. But in general, especially after we complete our mass mailing, if a person's benefits changes and SSA changes that claimant account number, your Medicare number will stay the same. All right, we had another question on Medicare Advantage. MBI does stand for Medicare Beneficiary Identifier. Generally, that's the terminology we've been using with the provider community. With our beneficiary community, they relate to the term Medicare number. So all of our outreach and education materials that are focused with the beneficiary, any form that a beneficiary completes will have the label Medicare number. All right, Nebraska, yes, your MAC portal, someone from Nebraska was asking about the MAC portal, the same as WPS.GHA. And while Dr. Postal was doing her slides, I did quickly look at our MAC distribution list or state list, and yes, confirmed that WPS-GHA is the MAC that serves Nebraska. The next question. New numbers will be given to state Medicaid and supplement insurances. Question. Will or can the numbers upon request be sent to IHS facility if names are submitted? So starting in June, I guess the answer is we are not disclosing a person's Medicare number until we mail a card to that beneficiary. So if the person has been mailed a card and it's after June, then the facility can log into their MAC portal and look up the person's NBI. If it's June and the person we have not mailed their card yet, then you would not be able to get their NBI until we have mailed their card. Next question. Will the letter be available in the Navajo language? I need to go back. I apologize for not knowing all the different languages we translate. I need to go back and ask that question of my Office of Communications and Tribal Affairs, unless I have somebody on the phone who can answer that.
Morning. This is Susie. That request has been sent forth. to the Division of Tribal Affairs to the CMS team. So that request has been put forward.
Thank you, Dr. Postal. All right.
One thing, can I just dovetail on something that you mentioned earlier?
Sure.
The thing is that with the lookup tool, if they do look up the patient's Medicare beneficiary identifier and it's there, you do not want to use that until the patient receives their new Medicare card. The beneficiary receives it. So that's really key. Until it's mailed and they have the card in hand, that's when you use the new number.
Thank you.
Mm-hmm.
You can see Dr. Postal and I have been doing this for quite some time together. She knows so much about this program. Moving on to next question. Will all MBIs conform to the same 434 alphanumeric format? The answer is yes. As a matter of fact, positions 2, 3, 5, and 9 will always be alpha. Okay. Can patients laminate the card, or does that make it voided? So the official CMS answer is the person cannot laminate the card. However, if the laminate, it won't void the card because a person can print out their card on their computer. So you don't have to use the card we sent you. The reason why we tell folks not to laminate their card is every health insurance setting has their own method for copying a card, and we certainly don't want someone to alter their card that makes it unreadable at a health insurance provider office. That being said, folks may still choose to laminate their card, but no, it will not be voided in that your number is still relevant. How was Social Security informed of any address changes? SSN is given so long ago, how do they know when people move? I'm glad that question was asked. The only way the Social Security agency knows that you have moved is if you tell Social Security that you've moved. They will not take information from the United States Postal Service. So there are several ways. One can go and change their address with SSA. You can go to a local field office. You can call them, or you can log into your myssa.gov account and change your address online.
Marnie, can I also add something to that?
Yes.
And that's one of the things that when we speak, when we are presented in the past in terms of getting ready for federal, tribal, and urban facilities, that you really want to make sure that the Social Security number address is correct. And really, if the address is different, have them log in to the Social Security SSA.gov My account and update it.
Thank you.
Mm-hmm.
Next question. Will the online portal for MBI lookup be online and up to date for all geographical regions in April 2018, or will it be updated in waves also? So the MBI lookup tool will be available starting June of 2018, and every MAC will have that lookup tool available. You're only able to retrieve a person's MBI once we have mailed that card. So if we have not mailed a card and you try to look up the person's MBI, we will not return the MBI back. But every MAC, I think we have 18, every single MAC will have their portal online starting June of 2018. So members will have their own portal before providers, correct? I'm not sure I understand that question. It says some members will have their own portal before providers. I might need someone to email that question to our new Medicare SSN removal address. And will the same Meridian website be able to verify the new MBIs? The cards for NYS will be made after June. Is this when the crosswalk will also receive for the first time? This is all one long question. I'm going to ask that can we grab this entire question, and if the person wants to, I don't know how we do the question answered back to the participants here, but because there's so many embedded questions in this one question, I think it would be best for us to come back with a complete answer, because I'm not sure what NYS stands for. Let me go back.
Hi, this is Julie, and I want to go ahead and just make a quick note. If there are questions that we are unable to answer, you and I can connect after the webinar and answer the questions directly, and then follow up with all of the participants today via email with answers to any questions that go unanswered today. Okay?
Thank you.
You can go ahead and move on to the next question.
Okay. On slide 31, it states that members can find out when their cards are mailed by visiting Medicare.gov. So there's two pieces of people finding out when their cards are being mailed. There's the just go to Medicare.gov, put in an email and the state, and when we start mailing to that state, the person will get an email. If a person wants something that's more specifically related to them, they can log into their MyMedicare.gov account, and we would alert the person through their MyMedicare.gov account that their card has been mailed. Tennessee is in the last wave of new Medicare cards. Do we have any idea what month they will receive their new card? So we have given ourselves, we start in April, and the law requires us to mail these new cards with new numbers by April 16th of 2019. So we are looking to mail these cards over a 12-month period. If things go well, maybe it'll end earlier. If things don't go well, so all we can commit to right now is to say that the first two waves we are hoping to complete during April through June. As we start up each new wave, we will update our website and let folks when that is mailed, when we're starting to mail those cards. What can I do if I don't get my card? We will actually have information about that in our outreach and education materials. Julie, I definitely want to take that one back and provide a more complete answer. What is the website again where beneficiary can check the status of their new card being mailed? So again, Medicare.gov will have information on the mass mailing in general. If a person wants to sign into their MyMedicare.gov account, they will get more specific information about whether or not their card has been mailed. How will this work with patients who also have Medicaid? So it varies state by state. We are working with each state, but every person with Medicare, even the duals, those who have both Medicare and Medicaid, will get a new Medicare card. Are there any plans for tokenization of the new MBI cards to be added to mobile wallets, wearables? Right now, no. The answer is
Great
no.
question, though. It's a great question. That's that too. Great question. Answer is no. Not right now.
Will the Medicare beneficiary be able to enroll in a new Medicare Advantage plan using either the HICN or MBI number during this transition period? Great question. Hadn't seen that one before. The answer is yes. Medicare is sending out the new cards, but if a beneficiary doesn't receive their new card, should they call 1-800-MEDICARE or should they call Social Security? Call 1-800-MEDICARE. Oh, Susie, I believe this next one belongs to Dr. Postle. Will the 2014 EHR RPMS be able to accept the letters numbers when putting the Medicare number into their records? Dr. Postle, I'm going to pass that one to you.
So when we were talking about the different applications, the new Medicare beneficiary identifier, it was identified all the impacted applications, and wherever there was a HICN or health insurance claim number, we will be able to accept the new Medicare beneficiary identifier. So we are going to be working with registration staff, to get ready and address, when a patient comes in to accept the new Medicare beneficiary identifier. So that's one of the applications, is the patient registration, the third-party billing, health contract health management systems, point of sale, accounts receivable, the dictionaries and practice management suite. So yes, we will be able to accept that new number.
Thank you.
Mm-hmm.
I love this next question. If an individual who becomes qualified for Medicare before their state's distribution time frame, will they receive a traditional Medicare card or an updated Medicare card? Anyone who has activity on their Medicare accounts starting April of 2018 will receive a new card. So if a person is becoming eligible and they're already collecting retirement benefits, they will be, if we're sending them a package before April 1st, they will get the old card. Anything after April 1st will be the new card. How do I determine if my health providers are committing fraud? Will I receive a financial reward for informing them? Well, I would have to defer to my program integrity, my Center for Program Integrity around our fraud policies and programs. We are changing. Yes, we are changing the new Medicare number in an effort to better protect the Medicare funds as well as better protect the beneficiary by not disclosing the Social Security number. But it's not changing our Medicare fraud programs. Okay. Will fee-for-service Medicare patients eventually be transferred automatically to Medicare Advantage? Well, while that's not part of the new Medicare card project, I don't believe it's Medicare policy to transfer patients from fee-for-service to Medicare Advantage. It's always they have choices. And every fall, we encourage our beneficiaries to look at those choices and make the best health care choice for them. What's the difference between HICN and MBI number? The health insurance claim number, which is on cards today, is based off of a Social Security number, whether it's a person's own Social Security number or a family member's. The MBI is not based in any way, shape, or form on a Social Security number. It's a completely random 11 alphanumeric number. Both serving the same purpose.
And one thing to note, for those who have the slides, you can see the comparison on slide number 4, where the examples show that the Social Security number, the claimant account number, the HICN, they all look like Social Security numbers, where the MBI is just very randomized, letters and numbers. .
I love that's my favorite slide. Will members receive a letter in the mail informing them that they should expect to receive the new card? No. The letter, the card are all being mailed at the same time. We are using a variety of outreach and education strategies to inform Medicare beneficiaries as to when we'll be mailing cards in their state. Will the MAC portal indicate the card was mailed to the client? I need to check on that answer. The MAC portal won't display the MBI unless we have mailed the card, but I do not know if it will actually display the date that we've mailed the card. So I'll need to get back to you on that. Is everyone of all ages going to get the new card, or is it just a certain age group at first? Every Medicare beneficiary is getting a new card. Everyone. Will the new number work with the MARC system? Yes. And that's our Medicare Advantage prescription drug enrollment system. Will Medicare.gov Plan Finder be updated to plug in HICN and or MBI from April 2018 through December 2019? Yes. The MBI HICN crosswalk files are supposed to be sent to plans on March 4th. Are they still on schedule? As far as I know, the answer is yes. And that's to our Medicare Advantage plans. Will new beneficiaries as of April 1 get the new BIN, I guess that means the new BIC, even if the state is in the last wave? I'm not sure I totally understand the question, so I apologize if I'm not answering it correctly. When a person becomes eligible for their retirement benefits or eligible for Medicare, SSA will assign them a claimant account number, which includes a Social Security number plus that beneficiary identifier. That identifier still exists in Social Security Administration. They will get a new Medicare card. They will be with a Medicare beneficiary identifier. Let's see. If a patient uploads their card into their photos, can it be accepted by other copies sent from the phone? I guess it's dependent on the provider and how they're willing to accept your proof of Medicare. That would be a choice of the provider community. Where did you say we could go to find flyers and information brochures for our patients? So if you go to our CMS.gov website /new card, under our Partners and Employers tab, there should be a link to ordering products. Can the new MBI be used for reporting to CMS? If not, when will this process be updated? Yes, the new MBI can be used for reporting. Can you repeat the positions? Thank you very much to this person. I thought I heard you say 2, 3, 5, and 9. I thank you for correcting me. Okay, can you repeat the positions on the MBI with the alpha? I did say 2, 3, 5, and 9, but there are CMS materials stating the MBIs will have alpha positions in 2, 5, 8, and 9, and that person is correct. It is 2, 5, 8, and 9 will always have alpha positions. Thank you very much for correcting us. I know a lot of my elder tribal members don't have access to computers or internet, so do they have to go in person to the Social Security office to make any changes. You can call Social Security and use their telephone customer service, and they will provide a variety of services to you, such as updating your address. Is there a contact person or number we can reach out to as questions arise? We have an email account that is monitored daily, throughout the day, all day, every day. At the end of this presentation, that email address, and it really is the best way to contact us, is using that email address. I believe it's new Medicare Card SSN removal at cms.hhs.gov. And that is the last question that we will take today.
Okay, thank you so much to Ms. Land and Dr. Postal for joining us today and sharing information about the new Medicare cards. We're going to go ahead and end the webinar session now. So in closing, I would like to remind everyone that today's webinar was recorded and that the audio and presentation slides will be made available online at cms.gov on the LTSS Technical Assistance Center website. In addition, we will follow up today's webinar with a FAQ for some of the questions that came through today that were not answered, and we will submit those to our presenters today to respond to, and then we will follow up with everyone at a later date, and we'll also include a link to the presentation slide set as well. So again, thank you for joining today's webinar. Our session is now concluded.